Hi, everyone, and welcome back. I hope you enjoyed our first session, and we're heading into our next one, a deep dive in self-direction led by Paul Aronsohn. Paul is currently serving as New Jersey's statewide ombudsman for individuals with intellectual or developmental disabilities and their families, a position to which he was appointed by Governor Phil Murphy in 2018. As such, he serves as the administration's lead advocate and ally for New Jersey residents in the need of critical services and supports ranging from early childhood through adulthood. We are honored to have Paul here, and I know you're going to love this session. So with that, Paul, welcome.
Great. Thank you so much, Maria. And good morning, everybody. It's great to be here and to have this opportunity. What I thought I would do is, I know many in the audience are probably familiar with our office now, but I thought I'd spend a few minutes sort of talking about what it is we do, who we are, how we do the work we do, and so forth. And then get into a discussion of self-direction. And I'm going to talk a little bit, but I'm going to open it up early for questions and comments and suggestions so we can hopefully have somewhat of a conversation. So with that, again, as Maria noted, my name is Paul Aronsohn. I am New Jersey's ombudsman for individuals with intellectual or developmental disabilities and their families. And aside from having one of the longest titles in state government, what that means is that on a daily basis, I have the opportunity to work with individuals and families on issues that are very important to them. Our office was, as Maria noted, is relatively new. It was created actually by the state legislature in December 2017. Governor Chris Christie signed it into law in January 2018, and I was appointed by Governor Murphy in April of 2018. So we're a little bit over 6 years old. And this really has been an experiment in human services. I don't think there's anything quite like it in any other state. I know people have different states have different variations, but this is an office and a position that was born out of the recognition by folks in the New Jersey legislature that while New Jersey has a lot of resources for individuals, children, as well as adults with intellectual developmental disabilities, it's a very complex system. And for folks, individuals and their families, working through the challenges that are associated with lifespan disabilities, the system can be overwhelming. As I'm sure I'm preaching to the choir here, but there are so many offices and so many divisions and so many acronyms and programs and policies, it can get confusing, and a lot of it changes. And so they created our office to be a resource for individuals and families. And right now there's 6 of us in this office, so we're growing slowly but surely. And we take a very personal approach to the work we do. As many of you probably know, we talk one-on-one with individuals and families on the phone, now through video, and whenever possible in person. I spend a lot of time in my car traveling the state, visiting with individuals and families in their homes, in local coffee shops, diners, wherever, schools, and places of employment. And we take a really personal approach to our work, and we think that's really important. The legislation that created our office, listed a set of responsibilities, and we've sort of grouped them into 3 buckets. First and foremost, it's working daily with individuals and families to help make sure you get the services and supports, not only that you need, but that you deserve. We always put an emphasis on deserve. What that means for me, particularly, is on a day, I spend probably about 80% of my time troubleshooting with families, answering particular questions, maybe just connecting them to a particular office or giving them a link to some information on a website. But more often than not, it's sort of working through one or more challenges with an individual or family. Sitting in with them on meetings. We sit in on IEP meetings. We sit on meetings with Division on Developmental Disabilities. We sit on meetings concerning, folks in, who are enrolled through Perform Care in the Department of Children and Families. We advise families. We help them navigate the system. Some families come to us, some individuals come to us, with one-off question. Just they need to sort of have an answer to something or they need to be pointed in the right direction. Many folks, though, we have an ongoing relationship with. In fact, I've been working with some families since I started this job a little over 6 years ago. Uh, and so that's the main bulk of what we do, really just trying to help make sure that folks are getting the services and supports that they need and deserve. Second, because of the way we work so closely with individuals and families, we try to use what we learn from them about what's working and what's not working in the system. And we work with our colleagues then in state government, in the governor's office, in the different departments, to try to improve the system. We try to take what we learn and we try to sort of build on which is working and fix that which is not working. And we sort of serve as like a nexus, if you will, between those making decisions and those impacted by the decisions. And so we're in a unique position, if you will, to sort of help identify, shortcomings and areas in need of improvement. And third, and this is sort of overarching, we work daily to help make sure that the voice of individuals and the voice of families is heard, and that it's heard in a meaningful way, not just on issues that are important to that individual or family, but again, trying to inform the larger policy discussions that take place throughout the state, making sure that individuals and families not only have a seat at the table and that their voice is heard, but whenever possible, helping them to sort of drive the conversation. Because again, no one knows better what we're talking about than the individuals and families sort of on the front lines and, living this daily. We have an office in Trenton. Again, there's now 6 of us in the office. I probably come to the office a couple times a week, but I spend as much time as I can actually being out and about, if you will, meeting with individuals, meeting with families, meeting with providers, meeting with advocates, legislators, whoever. We take a very personal approach, as many of you probably in the audience today know, and we think that helps us because it not only makes it easier for an individual family that they don't have to come to Trenton, that we go to them, but I think the conversations in person are some of the most important and, rich and, and really give us a better sense of what that individual or family are dealing with and some of the challenges. By being with folks in their homes and, going to their communities, we get to meet other family members and we get to see how they're living. And so it really helps us to not only help them, but again, as we engage with our colleagues throughout state government, help to inform the discussions that take place, particularly in Trenton. We work again with every age group, and children, adults, families, and we work on every issue imaginable. I can't underscore that enough. Usually a day doesn't go by when somebody raises a question or an issue that we haven't dealt with yet. And while we don't always know the answer to a question, we are in a position to help families and individuals get an answer. Again, we work very closely with our colleagues who are very responsive to our requests for information. So it's been great. It's been an experiment. We've been sort of evolving and sort of building, sort of the plane as we fly it, as they say. And, I think so far so good. But not surprisingly, perhaps, is the fact that most of the time when people come to us, it's with a problem. Sometimes it's a time-sensitive issue. Oftentimes, families and individuals are in crisis. Just by the nature of our office, we're a place they turn. Sometimes we're the last place they come to. Sometimes, we're one of the first. But we deal with a lot of folks struggling through really difficult issues. And we do our best to help them. And again, that speaks to sort of the ongoing relationship we have with a lot of the people that come to us. Perhaps not surprisingly, that means we work on a lot of issues concerning abuse and neglect, particularly in some congregate living settings. We deal with folks who have autism, it's what they call severe autism, the challenging behaviors, and who are just not getting the supports and services that they need and deserve. We work with a lot of folks with medical complexities. Again, the same thing. They're just, I won't say falling through the cracks of the system, but the system's not serving them as well as it needs to. So this is how we spend a lot of our time. And not surprisingly, we spend a lot of our time and focus with individuals and families who are self-directing. And we spend a lot of time with them because it's popular in New Jersey. a lot of folks, I think, increasingly are turning to self-direction as an alternative to provider-based, supports and services. And I think, there's, like with anything, there's opportunities and there's challenges with self-direction. And opportunities are pretty important in that, it really gives the individual and gives the family more choice, more independence. It allows for more person-centered planning and execution of plans. Because you're in the driver's seat. You're putting together the program. You or your loved ones, doing this with the help of agencies, and organizations like PPL and Easter Seals. But it really gives you an opportunity to sort of, to build the life, that you or your loved one want and deserve. Allows you to hire staff members of your choosing, including family members. An important development since the public health emergency, that you can hire a parent, a family member. It allows you to sort of, use your budget, put together your own program. You can do a hybrid program, you can do self-direction and use provider-based agencies. Or you can, put together your own plan and use your budget for classes in the community and what have you. So it's a great opportunity, and the promise of self-direction is extraordinary. But again, as I noted earlier, the people that come to our office usually come to us with an issue, with a problem, with a challenge. And that's true across the board, but also with self-direction. I would say, in terms of self-direction, some of the biggest challenges are, first of all, it can be time consuming. Again, you're taking, the individual, the family member is taking on a bigger role. So there's more responsibility and there's more work to be done. But, there are things like, the amount of salary or wages you can pay to your staff. There's some limitations on that. We deal with some folks that have concerns about some of the administrative processing of paychecks and what have you. And then, interestingly enough, we work with a lot of families that are, yes, concerned about the here and now, but they're also concerned increasingly about the future. And that actually speaks to the importance of and the important role that self-direction plays in the lives of individuals and families here in New Jersey, because families want to maintain it. And the concern is, and we hear this a lot from parents, what happens when we're gone? We're not going to be here forever to take care of our adult son or adult daughter, to help support them. Who's gonna help make sure that they can live in their own apartment? Who's going to make sure that they can, continue to hire the staff of their choosing and to live the life of their choosing? It's an issue, we're engaged with a lot of discussions with family members about, but also our colleagues, and particularly in the New Jersey Department of Human Services and in DDD, the Division of Developmental Disabilities. These are ongoing conversations, and people are trying to think through sort of the next stage, if you will, of self-direction. And as I understand it, we're not alone. Other states are trying to find their way through it. So that's a good thing. But, self-direction is such an important opportunity and option available to folks. And in fact, it's not always, I shouldn't maybe characterize it as an option, it's an alternative, because for some folks, they don't actually see it as an option because they've had a bad experience with provider-based services, or they've heard stories and they have other concerns. And so to them, it's the only option, if you will. But it's great. And we do a lot here in New Jersey. In fact, DDD over the last year or two stood up an office on self-direction education to help families sort of navigate, sort of the self-directing processes and opportunities. So, it's great. We deal again with a lot of the challenges. I'm sure some of the people in the audience have contacted us, and we work through, we're about to put out our next annual report. That's something I should have mentioned. We do a report every year that goes to the governor, the legislature, and anyone who will read it. We put them up on our website. And one of the things in our upcoming report is a chart, actually. I'll just flash it here. It's a little teaser. But it sort of compares self-directing versus sort of agency provided staffing. And some of it speaks more to the limitations of it. Again, that tends to be where our focus is. So we're hoping that sort of the conversations about, improving it, taking it from good to even better, and expanding it to more individuals and more families throughout the state. So with that, maybe now's a good time to sort of take a break, take some questions, some comments, if anything's come in. I'd love to hear what you think. I will say, for those who don't want to necessarily raise a question now, or have a suggestion, they want to talk one-on-one, feel free to reach out to us at any time. I'm sure our contact information is available. Again, we talk with folks one-on-one all the time, in person, on the phone, whatever makes the most sense for you. So I really encourage you to sort of reach out to us. So with that, Maria, I don't know if there are any questions.
Yeah, Paul, we had some previously submitted questions, so why don't I start with those, and then if there's any from the live audience, we can include those as well. So I think the question from many people at PPL, and then from some of the inquiries we had, is what is the main thing that people hesitate about regarding self-direction when they're deciding to get in the program?
I think excellent question. I think, again, based on what we've heard and over the last 6 years or something, it can be a lot of work. These are individuals and these are families that are already living often challenging lives. And to sort of take full ownership of your sort of plan, if you will, through self-direction requires you, a level of both time and effort. And then there are, inevitable administrative challenges that come with that. I mean, you're not only recruiting staff and hiring staff, but you have to take care of the drug testing and the fingerprinting and making sure that staffing is covered, in every shift. And so there can be a lot of work. So some families just don't have the bandwidth. They don't have the physical or emotional bandwidth to do it. Others, have found their way. And again, some folks do a hybrid. They rely on agencies for some services and supports, and they do some self-direction on their own.
Yeah, terrific. And besides family members, have the families that you've spoken with told you how they find caregivers besides the members of the family themselves?
Yeah, any way possible. I mean, some advertise online, some word of mouth. I think, and again, some folks do with family members. One of the big barriers here, and this is one that we deal with here, is that there's a limitation on how much you can pay a self-directed employee. Right now, the limit is $25 an hour. There are exceptions that the division will make depending on the needs and the credentials of the needs of the individual and the credentials of their potential staff member. But that $25 is not much money. That's before taxes. There are no benefits. I think, one of the things, and this is one of the issues we raised more generally, not just with respect to self-direction, but also in terms of direct support professionals, through agencies, we need to pay folks more. I mean, it's just as simple as that, and I think if we did that, it would make it much easier to attract a professional workforce, and you'd be able to have the direct care that you need and deserve.
Yeah, absolutely. We have a question coming through from someone here live. Where is the starting place to get into the program? And they also ask if they can meet with you. So we'll make sure that they have your information to contact you directly. But where is the starting place if you're interested in the program?
Sure. I think the first starting place is on the DDD website. They did a nice job of sort of outlining sort of the two approaches to self-direction, using either PPL or using Easter Seals as what they call the agency for choice. I would go on the website. If you can't find it online, we can certainly direct you there. And they've done a nice job of explaining what both programs are. I think that's a good starting point. Certainly coming to us or talking to your support coordinator is a good idea. And again, the DDD has set up this office of self-direction education. I don't know exactly the title of it, but they have folks there that can also help families sort of onboard and walk through the process.
Excellent. And I will say just to that, if you go on to the PPL's website, PPL First, FIRST, PPLfirst.com, you can select your state, New Jersey, and there's a whole host of program information there for you as well. So thank you for the question. Okay, I got a lot of questions coming in here. And also, Paul, I just want to let you know, so many comments, nice comments about you. Great to know your office exists, and comments appreciative of your empathy and the work that you do. So I just wanted to make sure I pass that on. So here's some questions. It's how do we hire employees? And where does the budget come from? So we talked a little bit about employees, but you can expound upon that. And certainly as a fiscal agent, PPL helps you provide information packets for you and your employees, but Paul will give some other information and then the budget question.
Sure. So it starts with, onboarding into DDD. And part of that process is, after you do the NJCAT, which is the comprehensive assessment tool, which is a questionnaire to determine a person's, abilities and needs. And based on that, the individual's assigned a budget, an annual budget. And using that budget and working with a support coordinator, which is basically like a case manager that works with you, you put together a plan and you have that budget, and that budget can be used for, again, provider agency services and supports, and or for self-direction. And some folks actually, who are in self-direction also use some of that budget to pay for what they call a support broker, who can help you even further sort of really identify, resources in the community and help you, recruit staff, for instance. So that's the budget you use. And again, it varies depending on the level of need.
Excellent. And you mentioned support broker. So there may be some folks in the audience who don't know what a support broker is. So maybe you can explain what a support broker is. And then we did have a question from earlier, which is, does the support brokerage come out of the individual's budget?
Yeah, so just to answer that question, whereas a support coordinator is paid through DDD outside of the budget, a support broker is a service that you can pay for with your DDD budget. And basically, and I may not get this exactly right, support brokerage is relatively new, but it's basically just somebody else who can give you a little more hands-on assistance, putting together the program, the plan. Sometimes they help folks, find an apartment if they want to, use their voucher and get an apartment in their community, or to hire staff. They're very focused. It's almost like a concierge service, if you will, really working closely with the individual and family for a period of time. It doesn't have to be ongoing. But I think it's particularly useful for families that are new to self-direction to sort of get going. It's definitely something, if you can't afford it through your budget, it's definitely something to consider.
Excellent. One administrative question, which I'll answer. Someone asked, what's the difference between PPP and PPL? So let me explain that, because they're very different things, although we work together. PPP is the New Jersey Personal Preference Program. It's one of the self-direction programs that are available to New Jersey residents. And then PPL is the fiscal intermediary for these programs. PPL stands for Public Partnerships. And the fiscal intermediary is the entity that helps you with things such as getting enrolled, getting your caregivers enrolled, making sure that you know what your responsibilities are in the program, helping you track time for your caregivers and get them paid and such. So PPL is the fiscal intermediary that helps you. PPP is the name of one of the programs. So just want to make sure that's clear to everyone. So we have a bunch more questions coming in. So we have a question. All right, I think I'll give this to you, Paul, but we may need clarification. Besides PPP and DDD, are there other programs that we can apply for?
The short answer is yes, but this would be more of a one-on-one conversation. I mean, there are different programs, for instance, PASP, Personal Assistance something program, is a program available to folks with physical disabilities who are working or in school or volunteering in the community to help get assistance, personal care assistance at their home. So there are different programs, but I would definitely encourage you to sort of reach out. We can have a one-on-one conversation about some of the options that are available.
Excellent. Okay, and then another question is support brokerage only for someone doing self-direction services?
Say again, I'm sorry, I had a
Is
technical issue.
is support brokerage only for doing someone self-directing?
I
Or is
don't,
support
I don't,
brokerage
yeah,
available for other programs?
I think, I think the answer is it's available to anybody with the DDD budget. I'm not quite sure. The experience we've had has been folks that have been in self-direction.
Okay, great. And I think we also had an answer there that yeah, it varies by program and what the support brokerage individuals do. So one question is, where does financial funding come from? PPP versus PPL. So again, PPL is the fiscal intermediary that helps you administer the program. The funding comes from the state. And so Paul, do you want to expand upon the funding for these programs?
Sure. Before I do, I'll just expand on, going back to a point I made at the beginning about the complexity of all this. And no one should ever feel, that they can't ask the questions that they're like PPP versus PPL. It can be overwhelming. There are so
Yeah.
many acronyms and so many programs. And I'll tell you, I've been doing this intensely for, over 6 years, and there are folks who've been doing it longer. We don't always get it right. We get confused, and don't ever, so it's good that you're asking these questions. You should feel free always to ask these kinds of questions. Again, the funding, anyone enrolled in DDD is assigned a budget, depending on their level of need, again, as assessed through that New Jersey comprehensive assessment tool. And that's an annual budget. And they range, frankly, from, I think, anywhere between $28,000 a year to about $500,000 a year, depending on, again, the level of need. And that's the budget. And that's the budget that allows you to hire staff, to pay for a support broker, take classes in the community, to enroll in a day program if you want. Again, if anyone has, wants to walk through, they'll be more than happy to sort of set up a meeting with you and sort of just walk you through sort of that process.
Okay, great. I'm just going to give a little plug for the next session before we take the next question. We're rounding out on the last 2 minutes, but we have a great participant interview coming up at 9:35 in 2 minutes. So I encourage everyone to view. So this is a person in the program. You can see what their experience is. So one more question, and then we'll head over to watch that participant interview. Lots of interest in you, Paul. So I'm sure you'll be hearing from a lot of the attendees, and that's great. We're really excited that you are so engaged. So the last question is, what is the application process for families who have a child under 21?
So under 21, it's what we call the children's system. It's a very different system than the adult system. What I would suggest is, reach out to us. It's done differently. Unfortunately, they don't have anything like self-direction in the children's system, but there are a lot of resources that are available through your school district as well as through the state's Department of Children and Families. So I would just reach out to us. We can sort of help, guide you and point you in the right direction and hopefully answer your questions.
Excellent. We'll make sure everybody has all the information. Paul, thank you so much. We are honored you're here and really appreciate all the work you do on behalf of the participants and their families. Let's head over and watch the participant interview. Thanks again.
Thank you.